Hi, I'm Josephine Banyard, and I'm a dog and cat dentist. And my objective is helping pets keep their teeth and their health. This presentation is aimed towards children. I've got a book, and it is called Healthy Mouth, Healthy Pet, Why Dental Care Matters. And you can get this through AHA bookstores online or Amazon.com. Okay, now I'm going to talk a little bit about human and dog years, like a comparison, okay? So 1 year in a human's life is, for a small dog and a medium-sized dog and a large dog, about 15 years. So you can imagine that by the time the dog is 1 year old in human terms, it's actually 15 years old because it's really grown quite a lot, and it's now a teenager at the end of the 1 year. And a lot can happen in your mouth if you don't brush them for 15 years, right? So likewise, as you go down, if you take your pet in to see the vet when it's 6 years old, a small dog is going to be the equivalent of 40, medium 42, large breed dog 45, and so on down the line. So a lot can happen in your dog in 6 years, right? At about year 2, year 3, we're sometimes taking teeth out of a dog because they are just rotten. And we're going to talk about that. Now, dental disease is the #1 disease in dogs and cats. Remember that, it's important, okay? To your dog and your cat, for sure. Okay, so I'm going to talk about the most common dental disease, and it's periodontal disease. These white yellow things are the teeth, right? And there are 5 stages of periodontal disease. This is stage 0. This is where the bone, which is the brown area, the brown hashed area, is where it should be. It's very high. It's just under the bulge of the enamel. This is the enamel over here. It's the surface of the tooth. And the gum is nice and sharp. You want a sharp gum. And this is a part of the gum here, where there's a line over here. It's called the mucogingival line. And then it goes up here to the cheek, right? Or to the lips. And then on the inside, this is in the palate. It's nice and sharp as well. And this is the height. No bone loss, 50% bone loss, 25% bone loss. And this is the root of the tooth, right? And this blue hatched area is periodontal ligament. That's what holds the root of the tooth in the bone, okay? So the tooth doesn't fall out. So stage 0 is where you and I and your dog want to be, okay? This is excellent. See my happy, smiling face? See how big that smile is? It reaches the eyes, right? So in this situation, you just brush your teeth and you brush your pet's teeth and everything's good. Stage 1 is you've got a little bit of inflammation. Now that inflammation is coming from the plaque. Plaque is bacteria. It comes from food, right? Bacteria grow in the mouth. Bacteria love the mouth because there's a little bit of food in there. And that causes swelling of the gums, okay? So when you get that, then food gets caught because it's not a nice slide like it is here for the food to slide down those sharp gum edges. It gets stuck, ka-chung, and then it builds up, and then you get the plaque build up, and then you get the swollen, infected gingiva. But the bone, there's no bone loss, okay? So this you can totally send backwards to a perfect stage 0 periodontal disease, and this is okay, all right? You see my face? I'm okay. I'm smiling, but it's not quite as big a smile, okay? In this situation, your pet wants a teeth clean, okay? And you should be in the dentist a long time ago, okay? Stage 2 is not so great, all right? Now you've actually got bone loss. You've got between 0 and 25% of the bone height is gone, okay? That does not come back. Cannot be sent back to perfect bone height. Here you've got some pus, you've got inflamed gums, they're more inflamed. Sometimes you don't see inflammation. Ow, it hurts. Ow, it hurts. Don't go brushing these teeth when you see red gums or swollen gums, because that's going to hurt your puppy, all right? This brown stuff here is tartar, and the orange stuff again is the plaque, okay? So you got pus, you got owies, you got buildup, not so great. Flat line, not good, okay? See your vet as soon as possible, and you can save these teeth, because you're going to be able to keep it so that there's still quite a lot of bone support there. Okay, stage 3, very bad, okay? Very unhappy look on my face here. See your vet yesterday, okay? Can we save, or maybe we should extract? And sometimes money talks here. So here you've got between 25 and 50% bone support gone. That bone is gone and is never coming back, okay? Unless you do some pretty complicated procedures. The gums are really red and sore and really swollen in some cases. And sometimes they are actually dropped a little bit. Instead of being where they used to be, they've actually dropped quite a bit. And you're starting to see that bulge of the enamel, right? So, ow, ow, very ow. Ow, ow, ow. This is stage, oh, I didn't write it down. This is stage 4, periodontal disease. Oh, I did, stage 4, okay. Fail. See how sad I am? Big tears coming down my face and going into the buckets of tears, okay? Actually, that's also you and your dog, okay? Everyone is sad because more than 50% of the bone is gone and the gums are really swollen. You've got lots of pus. It's an exciting tooth when you're seeing this because it's so gross, okay? And it's got all this pus and plaque and tartar over here. So the moral of the story is, you snooze, you lose. You don't brush your dog's teeth, you don't brush your teeth, they're going to fall out. Ignore your teeth and they will go away, okay? Now, is that a cheap teeth clean? I don't know, but it's a lot of pain, right, to go through. You wouldn't want to go through it, your pet, you wouldn't want to go through it either. So in pretty well all cases, except for very rare cases in which it's very expensive to save those teeth, usually those teeth are taken out. Okay? Okay, so what can we do? Well, regular home care and annual physical exams and teeth cleans, okay? They can do wonders. You want to brush those teeth every day for your pet. You develop a team. We can talk about that another day. So this is the tooth. Here's a happy gum. And the toothbrush head, this is a cross section of the toothbrush head. The bristles are squished because this brush is cleaning the tooth. And this shows you 2 millimeters. That's how far down the bristles can go under the gum line. Okay? Very important to brush every day. Every second day does not work. Fail. Okay? So, you want a cat and a dog toothbrush. For cats, just the cat toothbrush, but for dogs, I like the cat and the dog toothbrush. And you can go to the vohc.org online for dental diets, treats, toothbrushes, and toothpastes. These are all meeting standards set by the American Veterinary Dental College, and they are considered good products. They have proven themselves. And you want professional teeth cleans done at a vet clinic because you need anesthesia, you need intraoral x-rays of the teeth where each tooth is x-rayed to see what's going on in the gum, because if you look at your dog's mouth, if you cannot see the bone, the roots of the teeth or the bone, the chances are your vet can't either. So they need x-rays, right? And you want a place where the vet is doing all the surgery. And annual is a good idea. If you want to do the best for your pet, annual teeth cleans are good. And that's between you and your vet. So now, you brush your teeth twice a day. You see your dentist twice a year. Your dog, this is what you should do for your dog. Brush once a day, and you want to see the pet dentist for a teeth clean every year. Thank you for watching.